Hello, Happy New Year. I hope you had a good holiday season and even better New Year's. I'm here with my weekly update. Um, Overall, since my last post, I'm doing a lot better. Kind of went downhill there for a minute. It turns out I had a sinus infection. I had to go get antibiotics for because the things I was doing on my own weren't cutting it. Since handling that, I've been on them antibiotics now for like 6 days. I can definitely feel like the infection, or what I now know is sinusitis, was definitely impacting my brain. um, Whether it was through inflammation or whatever, it was something was up there. So in terms of my sinuses right now, I'm doing several things other than the antibiotics. I'm taking Doxycycline 100 milligrams twice a day, and that will be for 14 days. I'm doing neti pots or saline rinse with saline, a little bit of para-3, and then some carboxy to grab any mold or whatever that's in my nasal passages. I'm doing nasal spray with a product that I should be able to pronounce, but for some reason I can't. Xlear, Xlear, Xlear. Yeah, it's got xylitol in it. But doing that every day. Um, I'm eating, and honestly, this isn't just for the sinus stuff, but I'm crushing up 2 cloves of garlic every morning and letting it oxidize for 15 minutes, and then eating that on an empty stomach, kind of like a all natural antibiotic. I'm trying to think if there's anything else. Sleeping with a humidifier on if it's super dry. Um, I do have some antihistamines, some hydroxyzine that I will take if things get to be a little too out of hand and I can't take it anymore. Trying not to do that because there's an infection in there and I want to let that stuff drain and get out of my nasal passages. Um, I'm taking TheraFlu at night for cough suppression because I did have a bit of a productive cough there for a while. But overall, I think it's coming around. I think, I mean, I can hear it. I can hear that I'm still a bit nasally, but um, overall, man, I'm doing much better than the last time I posted. And honestly, with where I am with the things that I've done, so rapid gut reset is here, right above digestion. And then through rapid gut reset, I learned I have sinusitis from mold exposure for so many years. So, getting that under control. And then I also learned that I have Candida in my gut. Now, I've had Candida for years. I have tried antibiotics, diet, natural supplements. That raw garlic that I'm taking will also help with Candida. This time, though, I'm switching things up a bit. I'm doing 2 cloves, the spice. First thing when I wake up in the morning, I take 2 cloves, chew them up, swallow them. And then I'm also taking monolaurin with my meals, and I am actually shocked at how well that's helping. Like, I know it won't solve the Candida problem. I think the Candida issue is more so lying in the toxicity that's in my body, whether it's from heavy metals or pesticides and herbicides, mold, or all of the above, most likely. It's not going to resolve until I handle all of that. So, but for now, I feel like I have it under control. Not under control, but it's just, it's being, it's helping. It's helping. And that in combination with increasing my fasting to, I was fasting 10 to 12 hours every night. Now I'm up to 16 to 18. It's helping. I can't remember the last time I felt this good. Like I seem to have energy. I don't have to push so hard through everything. Love it. So I think that this is a good representation of how this process is going to be, as far as, going from the struggle bus yellow, which for some reason is the same color as my kitchen walls, up to the blue to the green. I think that's going to be spot on because I'm right here. I'm about to turn the corner. Um, and what I like about this roadmap is that it's not set in stone. Like, this is just a basic guide to follow. So Like I could take little detours right off and handle other things as they come up, but still keep in mind that this is the overall path I'm going to be following. I also just this week started a new program from Alex Howard for trauma. I am really excited about that. I have trauma of all flavors. I have childhood trauma, and more recently and very poignantly, medical trauma through gaslighting, and also surgical trauma from when anesthesia didn't work, which are significant things when you're dealing with a complex chronic case like mine and you need doctors. So, and honestly, me doing this on YouTube, blasting my very private personal information like this publicly, is because of the medical trauma that I've been through. I refuse to turn over my entire healthcare to one person ever again. And eventually I will tell you why. But for now, we're going to stick to the plan. Um, so that's kind of where I'm at on the roadmap. And I'll say this. So the biggest part of this update are my accomplishments. Um, this is so cool. So in 2019, I was told that I should stop driving because I was having panic attacks on the interstate. I couldn't do it. I was getting lost. I was forgetting where I was going. It was time for me to stop driving. Unfortunately, that left me housebound, and I kept getting sicker. And I have been housebound since then. And I have tried over the years to get out of the house, to leave, to go do things. It was a nightmare. I'd get out there, I'd have a panic attack, or I'd have to run back home, or my blood sugar would get weird, and I couldn't handle it. It would all be very scary. And then I had that whole series of panic attacks that caused agoraphobia. And I'm going to tell you, I worked through it this past week. Um, I went to the grocery store for the first time in years and was actually able to focus on the task at hand. I wasn't flipping out because of the fluorescent lights. I didn't have a panic attack when I walked in through the doorway, and that whole, like when you walk into Walmart or any grocery store, you go through the small doors and then you get in and like everything opens up. Because of the temporal lobe damage that I had, my brain wasn't able to calculate space like that. So it would cause me to get overwhelmed and panic. That didn't happen. Like I went and was able to get into what I was doing. I was looking at food I wanted to buy, thinking about things I wanted to make. I was not concerned about panic or whether my body was going to be able to sustain this trip or not. And it was so easy. I went a total of 4 times to the grocery store with zero issue. No Xanax, no panic attacks, no breaks, no blood sugar issues. I just was a human being again, just doing my errands. And that's huge for me. That's, what are we? It's 2025, so it's been 5-6 years since I've been able to do that. And honestly, longer than that. I mean, I had issues with agoraphobia and panic since I hit my head in 2006. So this is just a testament to my healing, and it gets even better. So as I told you, I have medical trauma. Going to the doctor, I usually get freaked out. I usually have to take Xanax. My blood pressure is usually off the chart, and it's always a hot mess. This time I went for my sinus infection, no Xanax. Blood pressure was perfect. It wasn't high, nothing. Even my heart rate was perfect. And I even went out another time to do something I've been putting off all year, and that was getting my eye exam. So got my eye exam. I tried on frames. I had a good time. I got a new pair of contacts. New glasses coming soon that aren't duct taped together. Like I feel like I'm able to kind of start living again. And there is no better gift for me, for my mental health, than to be able to do these things, to feel productive, and to not feel like afraid anymore. It's like the world has just opened up for me all over again. And I can't tell you how excited I am for this year. It's going to be good. So I think I'm just going to end my update on that note. And I will update in another week. All right. Take care. Thank you. Bye.